Hi, my name is Dr. Cozy. It's really nice to meet you. Can I have you verify for me your name and date of birth? Perfect, okay. So, you came back from some recent international travel, and a few days later started developing lesions and some peeling, scaling, red skin. Okay. How many days ago was that? Okay. Have you been picking at them or trying to pop anything? Good, thank you. Okay. And then have you had any fevers, any chills, night sweats? Okay. Nausea or vomiting? How about chest pain, shortness of breath? Sorry. I have this one renegade hair that keeps finding its way into my eyelashes. And any joint pain or muscle aches? Okay. How about headache? Any confusion, dizziness, loss of consciousness? And on your travels, have you done any swimming, especially like in lakes or oceans, rivers? Okay. Any exposure to farms or farm animals? Okay. How about any insect bites? Okay. And any unfiltered or tap water, any water that you might have drank that was not from a bottled source? Okay. And are the affected areas, are they painful? Okay. On a scale of 1 to 10, 1 being pretty minimal, 10 being absolutely excruciating, like you can't sleep, you can't focus, how would you rate that? Okay. And can you try and describe the pain for me? Is it burning, dull, throbbing? Does it radiate anywhere? Okay. All right. I'm actually going to put on some safety glasses because I will be taking a look at those, and just in case anything ruptures. No offense, I just prefer not to get it in my eyes. And actually, let's do it this way. Okay. I'd like to get a quick temp from you if you don't mind. So if I can just have you open for me. Great, thank you. Okay. Temperature is elevated at 102.3. Okay. So focus your gaze right here, right in between my eyes for me, okay? And don't move your head, okay? Just keep your head as still as you can. I'd just like you to follow my light, just using your eyes. Now, if you can just look up for me, I just want to take a look at your sclera, the whites of your eyes, to rule out something called icterus, which is when that area of the eye becomes yellow. It can indicate an issue with your liver. Alright, you can just look straight on, or just wherever your gaze naturally falls. Can I have you open for me? Perfect. I'm just going to press this down on your tongue so I can see your airway. The back of your throat. Just to rule out any lesions or swelling, drainage. Okay, I'm gonna remove my tongue depressor. I'd just like you to keep your mouth open for me. Great. Okay, and can you lift up your tongue? Alright, you can close your mouth if you'd like. And now I want to take a peek inside of your ears. And okay, so I do see here on the outside that there are some lesions present, and it looks like they are emitting some serous drainage. It does appear to be clear in color, so that's good. Okay. I'm going to be as gentle as I can, okay? But I just need to make sure that there's nothing inside of the ear. We will get a culture of that in just a moment. Excuse me. This side looks okay, inside too. A little bit of some pink coloration, but I'm not seeing any angry red out my otoscope cover so I can take a peek inside of your nostrils, okay? Alright. Your nostrils look okay. So, because I do see some active drainage coming from both of your ears, I'm going to take a culture and then I'm going to put a protective cover over both of your ears so that way we don't worry about any fluids, first of all, dripping on yourself, but also potentially potentially coming into contact with other surfaces. So, okay. I'm just going to lightly brush this over where I'm seeing that drainage coming from, okay? This cover is made out of the same material as my gown that I'm wearing, okay? So even though it is a mesh, it does prevent the spread of liquid. Left ear. Let's get you. going to take a quick listen to your chest. Can I have you take a deep breath in and out for me? Good. And again. Again. And one more time. Okay. You can breathe normally. I'm just going to listen to your stomach. Okay. Any tenderness here? How about on this side? Excuse me. And back here, any tenderness on either side? Okay. Then we will go ahead and start looking at your skin, okay? So, I'm going to use a light at first, okay? It is a bit bright, so if you need to close your eyes, that's okay. Pardon my gurgly tummy. Something that I've noticed is more of a thing as I get older. Probably something that has to do with perimenopause. What doesn't? Okay. That was weird. It didn't look like it turned off all the way. Okay. I'm gonna go in with a cotton tipped applicator so I can very lightly, don't worry, press on some of the affected areas and see what we're working with here, whether or not they are hard or if they have any give to them. Right underneath here. Okay. Okay. Just gonna feel for any lymph nodes, which, yep, bilaterally right off the bat, we got 2. Submandibular. And occipital. These ones feel pretty inflamed too. Bilateral cervical nodes. No supraclavicular. I'm going to reach under your arms, and I apologize if this is tickly. No axillary. Feel down the inside of your elbows. We're okay there. And then, I apologize for this, I'm going to have to check your inguinal area, which is your groin, but I'm not going to touch you, just the thigh area, okay? Okay. I'll be quick. Okay. No inguinal nodes, so that's good. So, let me just mark down where I did find them. Oh, what are you stuck to? We have submandibular, cervical, occipital. Okay. So I do want to take some more samples for culture. First thing I'm going to do though is take some measurements of these areas here on your neck, on your forehead. I was thinking about your neck as well, and sorry. So I'm going to measure this area that's affected on your forehead, on your neck, and then right here on each side that's going towards your shoulders. Okay? Just grab start here. Sorry, okay. So I'm gonna start right there. Okay. Okay. Leave that out to be sanitized. And take all of these just in case. So I want to start with this flaky skin that's up here on your forehead. And I'm going to irritate a little bit to get it to flake some more. So I apologize if this is uncomfortable, okay? now I'm going to take a few more samples for culture, okay? I'm going to run it for bacterial and fungal, and then we'll do another one for virus, but that's a different kind of transport medium, so we'll get to that in a moment. Sorry, I know. I can tell it's probably pretty tender. Okay. So now we'll take one for viral culture. Just trying to decide where from. I think we'll do the forehead. So I'm going to make sure that these samples are at the top of the list to be processed, okay? Because the faster we get answers, the faster we can come up with a treatment plan. I just need to take a few notes, but after I step out here, I am going to send a nurse in to take some samples to run for blood cultures, which will help us rule out anything like sepsis. And then I'm also going to go and consult with our infectious disease specialist and see if they have any thoughts, and they may come in here and examine you themselves as well. I am going to have you admitted, given the nature of these lesions, the fact that you have an elevated temperature, and that you were recently traveling internationally. I think it's important that we keep you here at least overnight for observation, and it may be longer. It depends on what your lab work says, okay? Okay. So give me just a moment here, because I like to write these up with our patients present. That way, if I need to ask any questions or do any repeat examination, I still have you. So. Okay. Thank you for being patient. So I'm going to go and process these, okay? And then a nurse should be in here in just a few moments to take some more blood. Sorry. But it's important. And she'll also be starting you on an IV. It'll just be normal saline to start, just to keep you hydrated. And then myself or another physician, likely an infectious disease specialist, will come back in here to talk with you. And then when we have an available room in the ICU, we'll move you up there, okay? Okay. In the meantime, if you need anything, there is a call button right there, right on the remote control. It has a little icon that's shaped like a little person that calls the nurse's station, and if you press it, someone will come in right away, okay? Okay. Do you have any questions for me before I step out? Okay. Well, if you think of anything, feel free to ask a nurse. They can page me, and I will be coming back and checking on you and repeating a new exam shortly. All right? Okay. You sit tight.